Clerk will call the roll.
Glenn Whitley, County Judge.
Here.
Roy Charles Brooks, Commissioner Precinct 1.
Present.
Okay. Andy H.
Is your
Wynn,
mic on?
Commissioner Precinct 2.
Here.
Gary Fickens, Commissioner Precinct 3.
Here.
J.D. Johnson, Commissioner Precinct 4.
Here.
Constitute a quorum.
Thank you. Our invocation this morning will be delivered by Pastor Stephen Klein from the Lake Country Church. Appreciate you coming out today. After the invocation, please remain standing for our pledges.
Let's pray. Well, dear Heavenly Father, God, we thank you for who you are, God, and we thank you that in the midst of all this chaos that's going on in our country, that, God, you are in control. That, God, it's ultimately you that we can trust in, not a president, not anyone else, that we can trust you, God, that we can have faith in you. So, God, I pray that you would give our president wisdom, that you would give our land wisdom, that, God, you would heal our land and heal our people, that, God, we would be unified under you. God, I pray that you would give this courtroom wisdom, that, God, you would just bless us, keep us, and that, God, we would turn to you in every situation. God, we thank you for who you are, God, and I pray that you would be with our men and women that serve our country, our police force, our fire department, God, our men and women that serve overseas. God, I pray that you would be with their families, that, God, you would bless them and keep them safe and bring them back home safe. God, we give you all the glory and all the honor, and we thank you for it today. In Jesus' name, amen.
Amen.
I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
Agenda announcements, Mr. Manius.
Thank you, Your Honor. Members of the Court, we have several announcements today. The first, under the County Administrator's section, item A1. This is the RFP for 2017-022. We're going to take that up a little bit later in open session. We're in the process of finalizing the calculations on the numbers. Also, members of the Court, under purchasing, items H1, this is the sale of recycled paper. There is a new court communication in your folder as it relates to that particular item. Also, just a note on item H4, this is RFP 2016-043. I believe that your court the agenda has it as a non-consent item. Your court communication is a consent item. We'll need to treat this as a non-consent item since that's the way it was posted on the agenda, so we'll deal with that when we get to that particular point. Also like to remind the court that we do have a work session today that'll occur after closed session. The work session will be in 504C on this floor. And then finally, the IT Steering Committee is meeting today at 2 p.m. in the Family Law Center. Thank you, Your Honor.
Thank you. Court members, you have before you the minutes of our regular meeting of January the 17th.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Next, you have before you the consent agenda.
Move for approval of the consent agenda.
Second.
We have a motion and a second. Please vote. Motion passes unanimously. Mr. Manius.
Thank you, Your Honor. Members of the Court, if we can move to item number 2 under the Administrator's section. We're requesting that the Commissioners Court approve an agreement between the county and the Council of State Governments Justice Center to continue the county uniform recidivism measure project.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Thank you, Your Honor.
Thank you. Ms. Tidwell.
We have one item we're asking the court to consider this morning. That's to receive and file the Tarrant County financial statements for the period ending November 2016.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Ms. Snyder?
This management board is recommending the payment of 2 claims, the first to Kenneth Conway Jackson and the second to 5 Star Correctional Services.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Thank you.
Thank you. Ms. Glenn? Uh-oh.
Move to receive and file the personnel agenda.
Second.
We have a motion and a second to receive and file the personnel agenda. Please vote. Motion passes unanimously.
Thank you. Our second item is requesting approval of an out-of-class pay extension for JP3. You've seen this one a couple times already. This is effective January 28th through April 27th. The cost to the general fund will be approximately $875.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Our final item is requesting approval of a waiver of terminal benefits. This is for Constable Precinct 1, their senior deputy constable position, effective February 1st. Current incumbent will retire at the end of this month with approximately 298 hours of vacation, the net cost being about $3,100.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Thank you.
Thank you. Come on forward. I don't look like Jack. You playing hooky today?
Thank you for that, Judge. He's under the weather, but he's sitting down in his office right now enjoying the proceedings.
Well, I'm glad he's sitting down in his office then coming up instead of coming up here and spreading it.
Yeah, that's why he's still down there. Okay, thank you. Yes, we have 4 items for your consideration this morning. The first one is bid number 2017-060. This is the sale of recycled paper for the 30-plus tons of OCC cardboard. For facilities management, we're recommending the award to the high bidder, Pinnacle Recycling, in the amount of $131 a ton.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Our second item is RFQ number 2017-019. This is for professional engineering services for various Tarrant County projects for the Transportation Department. We're recommending the award to the vendors listed on the communique.
Move approval.
Second.
We have a motion and a second. Any discussion?
Yeah, I got a question.
Yes, sir.
If a commissioner has an issue with maybe one or more of those particular companies, would we talk to purchasing about that or the transportation?
I would, since you can speak with us, Commissioner, but Transportation did make the award on, the recommendations on the award, and if we need to pull that and bring it back at a later time, we can certainly do that.
I'll talk to you or to
Okay,
Bill.
thank you.
Okay, thank you.
Any other discussion? Please vote. Motion passes unanimously.
Our third item is bid number 2017-055. This is the sale of sporting rifles, shotguns, and assorted handguns for the Criminal District Attorney's Office. We're recommending the award to the highest bidders, to the vendors or the bidders listed on your court communique.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
And our last item is RFP number 2016-043. This is for employee drug and alcohol testing countywide this is a renewal, first renewal. We're recommending to the primary and secondary vendors as shown in your court communique.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
Thank you.
Thank you, sir. Mr. McClellan.
Good morning. Before I begin, the sheriff asked me to extend his apologies for not being here in person. He's currently attending Detective Walker's funeral for the Little Elm police officer. We have one item before you today, and it's simply to approve the list of reserve deputies. And then since we have a new sheriff, it has to be updated to receive a new bond.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Thank you very much.
Thank you.
Are there any appointments today? There being none, then we will move on to our claims, including the addendum.
Move approval of the claims, including the addendum.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. Briefing items, Mr. Manius?
Thank you, Your Honor. We have several items to bring to you this morning. The first concerns an update on federal legislative issues. Mr. Pike's here to address the court at this time.
So did you send your draft of what the president should have said to him, or did
He didn't use mine.
he doesn't use you
He
anymore?
uses his own, I'm afraid. Good morning, members of the court. We wanted to come and give you an update primarily on the waiver and how the election influences our work there. The last time we were here in October, we had just secured, along with HHSC and THA and others, the 15-month extension, and then we had the election, which I thought was important to kind of talk about what that might mean. Let me briefly restate where we are on the waiver as of today. As you recall, we did receive a 15-month extension through December 31st of this year. This was the culmination of, again, a great team effort with HHSC in Austin, THA, others, including members of the court who traveled with us, and we conducted over 210 meetings to push for the extension. A few days ago, our friends in Austin at HHSC put in a request for an additional 21-month extension. This would last through September 30th of 2019. The thinking on this being that this will give them time to secure the funding levels at current levels while we see what's going to happen with the Trump administration and the potential for block grants. And you'll notice on the last bullet there, that is something that we're watching very closely. We'll know more here before the 28th of February, which is when the President will address Congress in his State of the Union. But he is working with House leaders on Obamacare replacement ideas, including potentially block granting money. There's also a letter which I will send out to you separately on email that the governor sent to House leadership, basically urging that while they are considering block granting Medicaid, that they also preserve and protect the waiver as is. And so that's, we're sort of all on the same page and arguing the same thing, but I'll send that out to you later today. The real sort of piece of news that I want to pass on to you is the relationships.
Before you go on to that, on the waiver.
Yes.
One of the executive orders that President Trump signed on the day of his inauguration was to direct all departments to do all things feasible to help mitigate the negative impacts of Obamacare. And in that executive order, he mentioned waivers. It would seem to me that this would be a good time to check and see whether HHS has received his message and how they intend to act upon it. I would give them an opportunity to take a bold step by extending our waiver as the president seems to have directed that they do.
Well, and it's a very important point, and one of the things that we feel strongly about, and I think that the governor's letter is reflective of this, we think that the 1115 waiver is sort of unique in what it does. There's a conservative case to be made for it. It's basically paying for results. And so the executive order was written in the broadest sort of language, as you know, and sort of encouraging take a look at everything. We think when they take a look at it, this is going to be okay. To your point, we want to be extra sure, and we are checking that out with all of our sources now. But we're concerned but not panicked, I would say. I mean, again, we think that there's a very strong substantive case to be made, which is why the governor went to the links to send the letter saying, we like everything you're doing, take a look at Obamacare, but we also sort of like what the waiver is doing. So we are checking it out. We are talking to all of our contacts, but we think factually and empirically we have a very strong case to make. So we will follow up on that.
So let's go make it.
We are. And we'll be, as we discussed last week, having you come join us soon. So, but that gets to the heart of the issue, which is we are going to engage with the administration directly.
I heard that the incoming Secretary of HHS, Tom Price, is in favor of the waiver.
So Price is an interesting guy, and by the way, he's having his finance hearing right now as we speak. He did his health committee hearing last week. He's a doctor. He's a former chairman of the House Budget Committee. He is sort of flexible on some of the waiver issues, and one of the points I was going to talk about on this slide. We actually know his staff pretty well. And so those are conversations we're in the process of setting up now. He obviously is trying to get approved first and foremost, but I think once he does, we're going to sit down with his team and sort of make the case that this is an important program to keep. And we hope that we'll have a receptive audience to that. But again, all of this speaks to the larger issue, which is we want to engage the Trump administration directly, which is the next slide in front of you. And the good news is, for the most part, the new president is selecting people who either have been in Washington for a number of years or in many cases were in the Bush administration with us, including the two top deputy chiefs of staff. One for operations is Joe Hagan, who was in the Bush 43 White House with me, and then the deputy chief of staff for policy, who is Rick Dearborn, who was Senator Sessions' chief of staff and is very close with Scott. So we're going to have very, very good contacts with the administration. We're going to be able to engage directly and make the case as to why the waiver makes sense. And then any conversations about block grants, making sure that our voices are heard on block grants. Mr. Price, we just talked about a little bit, pretty unique background coming into the job. And then also the new CMS administrator, Seema Verma, who comes from Indiana, where she worked with then Governor Pence, now Vice President Pence, on their waiver. Interestingly enough, they had a waiver as well. She worked on that issue with him, and she'll be the new CMS administrator, so we have good ties there as well. So
they also expanded Medicaid.
They did.
Governor Pence.
So as you can see, there's some real possibilities for us, both in terms of policy and our relationships. And I would also mention on the congressional side as well, there's some new appointments, some new people in new positions that could help us in our work this year. As you know, Kay Granger is now taking over defense appropriations. That committee represents over 50% of all appropriations funding, so she has tremendous leverage in that role. We also have Mr. Barton serving as Vice Chair of Energy, Mr. Vesey continuing on Armed Services, Mr. Burgess as Chair of the Subcommittee of Health on the Energy Committee, so another very good contact for us for healthcare conversations. Marching on Ways and Means, which oversees healthcare spending, and then Kevin Brady, that we know really well as the Chairman of Ways and Means. So we feel like we have really good relationships on the Hill and in the administration. We want to try to leverage those as much as we can, and we want to try to include you all when you're available, and we'll be reaching out. We've already reached out to a couple of you about some trips to make the case, both in terms of preserving the waiver and extending it and having a say on what block grants could look like. And again, the canvas is sort of blank on this. They're just sort of figuring out. It's sort of, Trump likes the idea of block grants, but they haven't worked out any of the details. We want to try to help provide some context for them on that. And so I think the perspective of the county can be really helpful in having those discussions with them. So we're in very good position.
My perspective on block grants is that in a county like Tarrant, where the population is growing at a very rapid rate, we could get to the point with block grants where either the cost of medical care rises beyond the amount of the block grant, or our population grows beyond the amount of the block grant, and that any gap over the amount of that block grant then becomes the responsibility of county government. That's a huge cost shift from the federal government to the local taxpayer. I think that as we have the ability to have input into the way these block grants are structured, we ought to be asking for some sort of flexibility so that we don't get left holding a tremendous sized bag as a result of block grants.
Yeah, our message thus far on the Hill, and again, we've just kind of started doing the rounds with the new Congress. Our message so far on block grants has been, if they're going to go down that road, our message is a maximum of dollars and a minimum of rules and regulations. We need flexibility, but we also need the dollars. And I think, we'll want to tweak that as we go, but I think that's basically the argument that we want to make over the next few months. And again, we're very early in this process, so there's a lot of time to kind of help them fill in some of these details, but this is the time to do it. And so we're going to be continuing our meetings and asking you guys to join us as well. Any other questions?
Is there a formula to determine the block grant that we can and should advocate for?
I mean, I think it's all to be determined, and
yeah, it's early days.
So I think that's why now is the time to sort of help them flesh out what this might look like and what would actually work. Anybody else?
Stay after them.
We will, sir.
Thank
Thanks.
you, Casey. Would you stick around?
Absolutely.
Members of the Court, the final briefing item is the legislative issues. As you know, the state legislature is in session now, and that's why you're seeing this on the agenda. And Mr. Mendez has included in your packet just some introductory comments as it relates to the legislature. The Senate has already created its committees, and if you look on the second page, you'll see that Tarrant County has representation on a majority of those. Obviously, Senator Nelson is the chairman of Senate Finance. Senator Hancock is the chairman of Business and Commerce. Senator Burton is the vice chair of Administration. And Senator Birdwell is the chair of Nominations. So the House has not done that yet. When I spoke with Mark yesterday, he thought that would probably be next week or the week after next before we get the House assignments.
Did Nichols get transportation? Where are the rest of them?
I don't know.
I'd like them, I mean.
We have an email and
Or
we'll
the
send that
Zoe
out to you all.
Okay.
I hadn't heard anything. I think we'd have heard something different if we hadn't.
I think Senator Bob Hall is the vice chair of transportation. Who's the chair?
Nichols?
I'm hoping.
Senator Nichols is the chair.
Yeah, this is just our delegation. I'll be more than happy to try to answer questions as it relates to this. Your Honor, we do not have the tally yet, and so we'll deal with item 1 of the administrator section when we come back from closed. Yes, sir. That's all we have at this time.
Then we will recess our open meeting and proceed to close to discuss items exempt under section 551.071, 072, 074, 076, and 087 of the Texas Government Code.
access all the courtrooms.
They'll stop you at security with a blue stripe on your badge. You can flash your red stripe and walk around security.
You mean county security or any security?
County security.
I never been stopped. I don't know.
You need a red stripe on your badge.
Yes, you do.
I didn't realize that.
Well, the red stripe, that's your
All
red
these
stripe.
See, the blue one is for Democrats and the red one's for
Okay. Never thought of it. I never had any problems, so.
You should have a red
How are you? Happy New Year.
Yeah, we all have
This
red
is blue.
stripes. It's that bad.
Mine's blue.
This is blue.
I never had any problems. I never questioned it.
We'll get you a new one.
Having returned from our closed session, we'll now address the following matters.
Your Honor, members of the court, if we can go back to the county administrator section, we'll go ahead and ask for action on item A1. We've given you the scores on that, and we're recommending that the Commissioners Court authorize the county administrator's office and also purchasing in the district attorney's office to begin contract negotiations with Cumming as the vendor for RFP 2017-022.
I move that we select Cumming Construction Management, Inc. to be the vendor of choice to handle the long-range planning and facilities analysis related to the Tarrant County Hospital District, DBA, JPS Health Network. Is that a long enough motion?
Yes.
Second.
We have a motion, a second. Any discussion? All those in favor say aye.
Aye.
Any opposed?
Yes.
Okay.
Thank you. Okay, members of the court, if we can now move to the briefing section. Just a comment before we get into it. As you know, the court has engaged Health Management Associates to assist us in the healthcare analysis and futuristic healthcare analysis as it relates to JPS. And they have done a lot of work, and the reason we're bringing this to you in a briefing or a work session environment is because we want to deal in greater detail as to some of the findings that they have come up with, and also to give you an understanding of where we're going to be going next, and ask for any comments that you may have on that. So Warren Line is with HMA, so Warren, I'm going to turn it over to you.
Thank you, GK, and thank you to the court for the opportunity to again meet with you and give you an update on where we are with this long-range planning effort. You have asked us to give you monthly briefings, and this is part of our commitment to make sure that you're fully engaged and aware of the work that we're doing. These documents are also going to be posted on the website for long-range planning, so it's always important that we, for the public who are following this important initiative, see that our project overview remains the same, and this is the same wording that you've seen in the past, but again, to make that as part of the record. Our agenda today is to comment on a couple of items to let you know where we are as in terms of our progress. A summary of some of the community voices that we heard from the focus group meetings, the community forums, and the individual stakeholder interviews. A bit of a preview on the community health needs assessment and some of the population projections that are evident from the various studies for both Tarrant County and Texas as a whole with regard to the next 30 years, and a conversation at the end about the next phase of our work, which includes the Blue Ribbon Committee. So I hope that covers the items that are important to you, and if not, please let me know, and we will I'll focus on those as well. You've seen this before. This is our monthly dashboard report. The takeaway is we're on time and are expecting to provide over the next several weeks additional draft portions of our report to GK and to the liaison team from JPS and from the county administrator's office. And that work is continuing, so the take-home is green light. We are doing just fine. What's more important...
Is it,
Yes, sir.
can we ask questions a lot?
Sure.
As we move through this? What is the status, have you met with the Blue Ribbon Committee, or have y'all made any contact with the Blue Ribbon Committee and its individual members?
We're meeting with the two co-chair Thursday of this week to outline how we're going to move forward with the Blue Ribbon Committee. We intend to have our first meeting probably within the next 2 to 3 weeks. But we wanted to make sure that we, the staff and the co-chairs were in sync as to how we were going to move forward, understanding how the format is going to be and the timelines as it relates to that. We were also, quite frankly, waiting for the action of the court as it relates to the second RFP that you just took action on. So we are meeting with the two co-chair, I believe, Thursday, and
But nobody's contacted the other 10 board members?
not yet. We were waiting for this meeting so that we could jointly with the co-chairs make that contact.
Okay, well, I had one of my people call and ask, said he hadn't heard a word.
Okay.
Yeah,
Wanted to know
I talked with one of mine too, and I think that we ought to say something to them. They ought to know that they've been appointed, that they've got responsibilities coming up so that they can be.
I agree.
We'll send out a document to them, but we should have sent out a document earlier.
Mhm.
But what we had intended to do was have this meeting with the two co-chairs first and then send that letter out. But we'll go ahead and make sure that it all flows so that the notification comes really pretty quickly.
Let them know what the delay is.
I will.
Following up on what Commissioner, with the two commissioners said, I agree. I think you ought to do that now and explain that you are meeting with, thank you for agreeing to be a co-chair, and give them a little bit of information that you're meeting with the.
We'll get those letters out.
I'm
We'll get
sorry.
those
Thanks for
letters
being a member of the Blue Ribbon Committee. We're meeting with the co-chairs. Hope to have a meeting in the next 2 to 3 weeks. You may find out that a third of them are out of town the next 2 or 3 weeks. And I think we need to touch base with them.
Commissioner, we'll get those letters out.
We made those appointments in November, if I recall.
It's done.
It was a big deal to get them done before Thanksgiving, and I thought we were going to be contacting them and moving forward, and I'm surprised that we've made no contact. So,
Okay. There were 3 components to part of our community engagement. As you know, the focus group meetings, the community forums, and the individual interviews. And I thought I would share with you to remind us of the process for the focus groups. They were held on November 3rd. They involved the JPS Joint Council and the Family Advisory Council. And the best part, real people who are actually patients of JPS speaking about their experiences, their hopes and aspirations. We had a total of 20 people involved with the focus groups. We do have transcripts and a summary of what we learned from those 2 focus groups. These are the themes. They're in no particular order, but I think it's important at the very start to note that behavioral health concerns were the most frequently mentioned issue, and often with very compelling personal stories about family members who have struggled with behavioral health concerns. And I know that some of the court members heard those as well at the community forums. But the themes from those 2 focus groups, the smaller of the 2 smaller conversations we had, certainly said that JPS improvements have been recognized and appreciated. There was a clear message that, as is the case nationally, to focus more on prevention and the social determinants of health, which often affect one's health status but aren't necessarily medical care, including food security, the availability of healthy food options, certainly access and transportation issues. Those two focus groups certainly talked about that they would like to see JPS services more systematically promoted. And what do we mean by that? The themes we heard were, in addition to the very important work that JPS does now in communicating to the community about the availability of services, they felt that it's important for additional, not initial, but additional work, presence in the community at community forums, at settings, and at agencies. In other words, to constantly remind the community of the availability of services at JPS, because healthcare is a complex system to navigate. Focus group talked about opportunities for improvement around the call center and wait times and callbacks for appointments. Talked about partnerships and the availability of other groups within the community to work with JPS, the county, and other healthcare providers. Behavioral health, again, as a priority. Interestingly, and this is certainly emphasized by our population projections, that more attention should be paid to caregiver support for the population as it ages in place, and the related issues of polypharmacy with the over-medication of seniors and the cost of their drugs. So the long-term care issues for the aging population certainly were mentioned and are connected to some of our population projections.
Could you talk a little bit more about the polypharmacy and exactly what that means?
Polypharmacy, and I can speak about that with my own mother and my mother-in-law, who each of them probably have 10 to 12 medications. And what the medical community has found is often seniors are receiving medications from multiple physicians, and the care plan and the treatment plan doesn't connect those medications, and sometimes, in fact, the medications counteract each other or create side effects which could have been prevented. So part of long-term care approach that I've learned from my physician colleagues is you actually ask that person to come in with their large bag of medications and say, what do you really need, how are these working together, and how are you paying for these medications, and can you find a more effective way to have the right medications and to remove those that are unnecessary from a cost viewpoint, or more importantly, are adversely impacting the ability of that person to have a healthy and fruitful life as they age. So polypharmacy was brought up, I believe, because in these focus groups were individuals who had parents and grandparents struggling with this issue. And it's a common issue around the country in terms of medication management for older persons.
The behavioral health issue, I know at the public meetings, at the one you had on the 6th, we had a number of people talking, but we had one person who probably spoke 5 times, stood up, got a microphone, and when you added up the entire time that person talked, it was probably 35–40% of the entire evening was dominated by that one person, pretty much saying the same thing. Do y'all kind of take that into consideration, that?
Well, the forums and the focus groups and our stakeholder interviews, which we'll be reporting on, all 3 of those opportunities consistently mention behavioral health from many different people. I think that the person that you're referring to, in part, was motivated by a personal experience,
Right.
and it was, probably important for that person to be able to express themselves in that repeated way. But I think it's fair to say that around the entire process of talking to the community and our work in other parts of the country, this is a very consistent theme, Commissioner. that there is a need for better behavioral health services. And most recently, Congress actually passed what is called the CURES, C-U-R-E-S, CURES Act, which reemphasized how mental health care should be on an equal footing with medical care, and that many of the issues involving incarceration, substance abuse, and issues of control of behavior are being seen by many people in various communities. So it's hard to understate the common theme that behavioral health is important, not only in itself, but how it affects the rest of the medical community who struggle with having access to services for individuals that really don't belong in a jail, and or are truly so troubled that it's stressing the families.
Well, I think my thought was that maybe that person was very polished in their presentation, and I just was wondering if that same person was at all of the meetings, talking.
I don't think so.
A number of,
I think he is right, that this is pretty well a well-accepted issue now, that we don't do a good job of behavioral health care, that for the indigent, there are very few options short of getting arrested to have your mental health needs met. I would say that just because that person may have engaged in bad meeting etiquette, it doesn't mean he or she was wrong.
Oh, no, I totally agree. I was just questioning that if you were an observer in the room, you would have thought, wow, this is the whole thing here. And it's all behavioral health. So that was just.
Yeah, Commissioner, I don't think, I can't remember seeing her. I know she didn't, if she was at the other ones, she did not speak like she spoke on.
Well, certainly the behavioral health advocates were very well organized.
Well, and that's kind of what I figured that we had there.
Right, so I think your question is more toward the methodology of arriving at these conclusions. But I'm sure to support these themes, you're going to have some hard data to back it up, right?
Absolutely.
Right, and if the data align with the theme, then we have a good business case.
I will tell you, though, that we had several, and I know one was at Commissioner Brooks's listening session, that was a mother who had to deal with her daughter. And she talked about her daughter had some severe psychiatric problems.
And I think she was at our meeting
at
also.
She was at the Northeast
Right.
meeting also.
Was she?
Right.
She was at the Southeast as well.
She was at the very back, right next to me.
Was she? About trying to get her daughter up to the 10th floor and riding in an elevator and that type of deal. So
Yeah.
there were advocates, but there were also individuals who had personal stories that they told.
I think one other thing, I'm not sure that we're doing a poor job. I think what's happening is, and that's, I guess, I'm not gonna say that we're not, but I would like to understand what other counties are doing, because my sense of it is that the state has continued not to increase the number of state beds with regard to mental health, and if anything, have cut that down, which has put more and more of a burden on the local counties. And so I'm not sure, given the resources that we've got available, that, that we're doing, I don't know how much different we're doing things than Harris, Dallas, Travis, and the other ones, and I would like to know that to some extent as we go through this process.
In fact, there was a legislative report issued at the end of December for this current session to review from the Health Committee. It's a very extensive report about the availability statewide of both acute psychiatric beds and the shortage of providers. And it's a statewide issue, as you said, Judge Whitley, and we are actually having work reviewing that report and other information to set the context that this is not just a Tarrant County concern, it's a statewide issue, so that there's no misperception that somehow Tarrant County is an outlier.
And I'll reiterate, my concern is there's a lot of emphasis upon mental health by this session of the legislature, or at least early indications about that, about CPS, about foster, and yet at the same time, they're talking about their less budget dollars, which usually means they're not going to increase funding anywhere. So if they're going to make these changes, they don't need to be making on the backs of our taxpayers.
Got it. The community forums, if I could move on to that, just to recall, we had 4 of them, and we wanted to introduce the process of this long-range planning. We talked about the population growth as one of our early findings, and again to inform the community and use a website. The process, as you recall, were well thought through, and I'd like to give you a verbal update that based upon the attendance for the 4, we had 158 persons who had signed in as participants. Not all of them spoke, but that's a very significant number of individuals across the 4 forums that signed in, and many of them participated. And we have listed for you, and you can take this course and think about it further, some of the themes that we heard. We've talked about behavioral health, so we'll acknowledge that as a high occurring comment. Transportation, no surprise there. There was a concern about the ability to seek care at the main campus of JPS, but also in some of the old regional medical homes based upon where people live. Theme was to have additional local clinics, and that JPS should focus on the needy populations, those unable to afford care elsewhere. These themes continue to show up in our stakeholder interviews, and I wanted to give you an update. We have 130 interviews that have been listed as individuals to talk to. We've completed 82%, and I can tell you my colleagues, including Lori Weiselberg, will tell you that is a very good percentage of completion. In community forums and stakeholder work that HMA has done elsewhere, and other companies as well, 82% is a remarkable number. But we are going to continue to strive forward with the remaining 23 individuals who are being scheduled as we speak. And in fact, I have an interview later this afternoon with one of the stakeholders, Dr. Fries. And so we're going to try to strive towards a higher percent, but we may not get there, but I would assure you this was a good response.
Well, if you, of those 23, if you'll let us know who they are, we may be able to assist in, pleading with them to be interviewed.
Okay. Part of it was the holiday season, and I think that delayed some response. We do have that list, which GK and Candace have in terms of who has not yet been scheduled, and we would welcome your support and to assure folks that it would not be about a large amount of time, a half-hour interview by phone at their convenience. One of the major parts of our work is a community health needs assessment. That phrase you'll have often heard because JPS is a hospital, other hospitals nationally and locally are required to do a community health needs assessment. Our approach was to look at a community health and needs assessment for the county as a whole, so a broader look involving all of the issues, not just one particular hospital. What did we find? Access to primary care and dental care is difficult. Infant mortality, this court has talked about that in the past, is a particular concern, as is a high rate of sexually transmitted infections, syphilis, chlamydia, herpes. Behavioral health is an important issue. Adult obesity, diabetes, high blood pressure, childhood immunizations. These are health indicators that Vinnie Tejeda and the others in the Public Health Department often comment on, that these are indicators of community need. The last one is on this page, linguistic isolation. This is a issue not only in Tarrant County, where when you combine a lack of communication in a language that someone normally speaks and transportation, make it difficult to navigate the health system in Tarrant County. This is not unique to Tarrant County. We've looked at population projections. This is so important. I know that many people in Tarrant County are looking at that as a important influencer, not only for healthcare, but other issues as well. You know these well. Growth, diversity, and aging are the concerns in the future. We've looked at U.S. Census data, also data from various state Texas agencies, and the numbers are stunning, 46% increase in the population in the next 20 years. And we try to sort that out by federal poverty level. The federal poverty level formula helps you understand, based upon household income, those populations which are vulnerable because of a lack of financial resources to either purchase health insurance or otherwise to obtain the kinds of care they need for themselves and their families. The 250% federal poverty level is a threshold that we try to calculate, because that is what the JPS Connection program uses currently, at 250% of the federal poverty level. And over the next 20 years, over 1.2 million residents will be at or below 250% of the federal poverty level. And a slightly larger amount.
Almost 50%.
It's 42%
of the projected population
will be below 250% of the federal poverty level. Now, hopefully, we can take advantage of that stunning number and understand that it is a factor in planning for health facilities, but I know many of the members of this court worry about transportation and roads. So these population projections are stunning. And in looking at the JPS Connection population, remember, this is for residents of Tarrant County, 18 years and older and non-Medicaid. And if you look at that group, the current population of those who would be eligible for the JPS Connection, which is for those individuals who do not have insurance, who are residents of Tarrant County, and otherwise look to JPS as the access point for care, that population will grow from 425,000 to 621,000 in the year 2037.
You may have said this earlier. Right now, define for me what 250% of the federal poverty level is.
Currently, for a household of four, it's 97,300, and it went up by about 1.2%. We just got the federal poverty level tables for 2017.
Wait, I want to be sure I understood what you just said. So you're saying that a family of four that makes less than 97,000?
Why don't we go back to the slide before this?
Sure. There we go.
Okay, so this one says 2016 income cutoff less than 250%, federal poverty level is 60,750.
Right. I'm sorry, I misstated that, GK. It's, thank you for that correction. The 250% federally poverty level is 60,750. You see it on the third. I'm not sure if this has
Okay,
a
I
clicker.
missed that a few minutes ago.
And for 400%, which is a higher level that is based upon the current Accountable Care Act exchange threshold. So the focus is $60,750,000 is the 250% federal poverty level for a family of four.
So the qualification for JPS Connection
is
250%.
That's correct.
Right?
That's correct.
And the 400% is the healthcare exchange.
It's the healthcare exchange. And depending on what happens in the future with or without Medicaid expansion, it's important to note that that 60,750 level, which went up about 1.2% for 2017, works out to 621,000 people in the year 2037. That's a very large number of individuals who otherwise may not have insurance that impact the health system of Tarrant County. And it is a factor as we are doing our analysis to appreciate the future planning for JPS, for the entire safety net, and for the private sector hospitals in Tarrant County in order to set the framework for need in the future.
Currently, if the 425,000 is correct,
yes,
then about 10% of that population actually subscribe to the JPS Connection program.
Well, remember, the JPS Connection program is not a managed care plan in which people are enrolled, although they are eligible for care. So we should be careful when you say that 10%, the 42,000, each year different sets of people access JPS for health care.
Right.
So it's not accurate to say that only 10% of the community is being served by JPS Connection. It's a much larger number. Some of these statistics, there are over 1 million outpatient visits per year that JPS provides. Much of the care is provided in the emergency department as well. So it's important, and we want to be careful and clear about our reporting. The point of this is to say, when you look at JPS and you look at the entire county over the next 20 years, there is a significant size of the population which will need care, and how do we plan for that?
Now, those people may qualify for Medicaid, right?
Well,
425,000?
Some of them will qualify for Medicaid if they are meeting the current categories, which is if you are a woman with a dependent child, you're covered if you're pregnant. But there are currently, under Texas Medicaid rules, if you're an adult without children, and your situation is that you are a resident of Texas and Tarrant County, there is no Medicaid coverage. So that's why there's a JPS connection for the uninsured individuals. The magnitude and the direction is what's important here to understand, and that one of our conclusions and recommendations will be, it's not just JPS. We certainly appreciate and celebrate the fact that all of the private sector hospitals, the federally qualified health centers, private physicians are all providing important care to the uninsured of this county. And part of our work is to recommend that how JPS, how the private sector hospitals collaborate even more intensely over the next years to work together in a way that provides as much care as we can afford to give in a way that's efficient and effective. Translated, try to move care out of the emergency department and into ambulatory regional medical homes where you can, in fact, provide ongoing care in a way that is what you would want to get as a primary care patient in a clinic, as opposed to episodic care in an emergency department. So the take-home is, it's very large. And the take-home is, looking ahead, it's more than just a hospital issue. It's how we provide integrated ambulatory care as well as hospital care in the future.
Wait, don't turn your page yet.
Okay. Sir.
I want to say something not at all from a standpoint of being controversial, but to me, it's a pragmatic reality that if JPS is going to stick to the policy of only treating documented residents, then we need to pay some attention to trying to expand the federally qualified clinic network, because that will then be the only place where undocumented persons in this community can get preventive health care. Now, the reason that is important is that just because they're undocumented does not mean that they're segregated away someplace. They are living amongst us. Their children are going to school with our children. They're cooking our food in restaurants. They're providing all of these services that integrate with us as a community, and for them not to be able to get health care endangers all of us. So if we are going to stick to that policy, then we need to be a part of making other arrangements for that population, which would mean lobbying the federal government to establish more federally qualified health centers in Tarrant County. So far, there's only one with a branch.
The North Texas Community Health Centers, which we acknowledged and interviewed Dr. Liz Trevino, I believe right now have 3 locations and planning a 4th. And it is the fact, looking at statistics, that they provide a significant amount of care to individuals who are not eligible for Medicaid and not eligible for JPS connection. I think it's important from our perspective that that's a policy issue, as you've raised, that the county needs to acknowledge and discuss. We are including those populations in our projected numbers, which we'll see later in this slide deck. So I certainly assure you, Commissioner Brooks, that from a viewpoint of counting populations and looking at the demand for care, that the segment of the undocumented populations are in our analysis.
I would submit to you that 3rd location is not in Tarrant County.
Okay.
There are only 2 in Tarrant County. It's in Hunt County, Mineral Well, Wichita Falls or someplace up there.
This slide is based on U.S. Census data and just projects the change in ethnicity and race for the county based upon the census surveys and the projected change in populations. And you can see that for Tarrant County between 2000 and 2010, these were the percent changes for the total population and by race and ethnicity.
Come back to that for just 1 second.
Sure.
Okay, the total population, that total at the top of 24% increase. Why don't the totals below add up to the 24.5? What are those numbers representing as you go down the percentage change?
The numbers within each of the ethnic groupings, the percentages show what percentage they are of the total population. So in the year 2000, the white non-Hispanic population represented 61.9% of the total population. It declined to 51.8% in 2010. And we do have another slide that takes it out further, showing that the percent change in absolute numbers, the 4.7 went up. That's 895,000 to 937 is a 4.7% increase. But as a share or a percentage of the population, the white, black, Hispanic, Asian, and other are growing at different rates and represent different future percentage of the population in Tarrant County.
Okay.
Taking it by age, These are the projected changes in population for early childhood, the overall adult, and the senior population. And as with the country as a whole, the baby boom generation is driving and distorting many of the statistics, and the point about long-term care as a challenge for the country as a whole, both for Social Security and for Medicare, is certainly going to be present for Tarrant County. We're all getting older faster in the country. These maps are very hard to read, and they're here as drafts, and I will assure you, when you see our report, they will not be this difficult to visualize. The take-home is that we are trying to translate much of the information into visual maps that show by parts of the county where are, for example, the expected growth in children versus the expected growth in senior citizens. So mapping it also against where we see primary care locations, federally qualified health centers. When we convert these to more readable maps, these will be planning tools for the Blue Ribbon Committee, for JPS Board of Managers, for all of you to begin making decisions and understanding the criteria for where, based upon expected population changes, the transportation routes, that ambulatory services are likely to be needed, and what is the best approach in sequencing what to do first. Part of that review will be, in fact, addressed by the Cumming Corporation, whom you just approved, because they will be reviewing the ambulatory network of JPS in terms of its current locations, its capacity, the opportunities that those locations can help meet the projected future need. So,
Can you tell us?
Yes.
Go back. How many non-downtown campus medical facilities are in the JPS network? The community clinics, the school-based clinics, the medical home facilities. How many of those have we got?
I don't have that accurate number in terms of downtown versus outside. Perhaps either Scott or Mary Ann knows that number. We will have it in the report.
Sure. Just generally, we have about 62 clinics throughout Tarrant County. Clinics mean a particular specialty provided at a particular site. When you look at sites, we have about 42 sites throughout Tarrant County. If you consider that on the main campus, we have our second largest clinic, Family Health Center, and some surgery specialty clinics are on the main campus, and the rest would be out throughout the county.
The ones outside of the main campus is what I'm interested in, and that number is 42.
Yeah, it's somewhere between probably 30 and 40. We'll certainly, working with HMA or us personally, we'll get to the exact number.
We also acknowledge, for example, that Cook Children's has a number of primary care pediatric clinics whom they subsidize for the care of poor children. And those are important points of contact. That's part of the map, as will be the federally qualified health centers. And perhaps there are other locations as well. The faith-based and free clinics, we'll have these on a map to show where they are. Many of them, however, are relatively small, especially the faith-based and free clinics. So their capacity is important, but from a larger viewpoint are not sufficient to meet the need. So our mapping will help guide planning purposes for ambulatory, both primary care, specialty care, and oral dental care and behavioral health, because many of those services need to be in the same location so that you have an integrated approach to care for the individual who has congestive heart failure, maybe diabetes, might have some depression, and hasn't seen a dentist in so long that they have oral health problems affecting their health condition.
What's the difference between JPS Medical Home and JPS? Is that supposed to be a circle and a square, or is it a?
Yes.
It's supposed to be a readable circle and a square, and we will get that visualization easier to see, Judge Whitley. The school-based clinics are characterized by location in a different shape than the medical homes because they are somewhat different in how they operate. It's also the case, and I'll just say this, that we certainly in our stakeholders learned of a very significant number of private sector physicians. They give free care too, and many of them volunteer for some of the free clinics, and that should be acknowledged and appreciated, that the medical community does work too that is maybe not always as visible to us, but many providers volunteer their time as well. But if you don't have a facility sufficiently sized for those kinds of volunteer efforts, it can be a struggle for a physician to make that commitment. But we are acknowledging that as well. So what are the implications? Tarrant County will need substantial additional healthcare capacity based upon the population growth. It's not just to have a building. You need physicians, nurse practitioners, licensed social workers, nurses, laboratorians. So the challenge in Tarrant County, and this is true nationally, is the provision of care requires providers of care. There is a shortage now. There will be more in the future. And so one of our report sections will talk about medical education, nursing education. What are some of the strategies that might be used so that we can retain not only physicians and nurse practitioners and others overall, but keep a sufficient number of providers whose mission is focused on the safety net population, that they would continue to be on the staff of JPS or the federally qualified health centers. Because there's competition for primary care physicians right now, and so medical education and the shortage is a factor strategically that JPS and the county as a whole will need to address. And we have to find different ways to deal with long-term care services and support for the aging population. You saw the percentages were 40.9%, and we will be making some recommendations and analysis on long-term care as well.
Will those include the ability to age in place?
Yes. Nationally, there are some very useful, innovative programs to help keep people like my mother at home or in an adult daycare center for seniors. You may have heard some of those phrases. There's a program called the PACE program. It's a small one nationally, but it's a way of providing adult care for seniors to keep them at home and not in a nursing home. There are other initiatives and innovations for long-term services and supports that some states follow that help keep care delivered at the home, activities of daily living, food, cleaning, lots of ways in which the seniors in our community can have a valuable life and a joyful life and not be in a institutional setting too early. And that's an important factor for the county to address is long-term care in the future.
Absolutely.
But the capacity assessment, which we will be working with Cummings on, covers primary care, specialty, acute care beds, psychiatric and dental, and we'll be looking at the sensitivity analysis of different parts of the county in terms of what we see as future demand. And that's part of our next step, which leads to the conversation we had at the very beginning, which is where we are with the Blue Ribbon Committee. So in summary, we have provided some draft reports to GK and to the liaison team. We're on target with providing draft reports and final report as scheduled. I think it will be useful for that final report to not be completed until the Blue Ribbon Committee is fully engaged and can guide some of that work. And if that takes a little bit more time than the expected delivery date, which was February 28th, HMA is certainly comfortable with that approach, because the whole point of what you've directed us to do is to be engaged with and listen to the opinions of the county residents. So we are very much focused on making sure that the Blue Ribbon Committee process works. And I'll turn that back to GK perhaps for further conversation on how we will work that out.
Right. We currently, as I said, our schedule for the Blue Ribbon Committee, we're meeting with the chairs on Thursday. We're going to move very quickly to get a full meeting of the committee.
How are you going to orient the chairs and the committee members to the work?
So what our plan is, Commissioner, is, first of all, on the meeting that we have this coming Thursday, is to bring in representatives. We have representatives from JPS, our representatives, HMA is going to be there. We're going to talk about the mission of the Blue Ribbon Committee and make sure that we're all on the same page on that as we move forward. When we get into the committee meetings themselves, what we intend to do is to make sure that we start, quite frankly, at ground zero, because we have some committee members that may not be as familiar with what JPS provides in the community, and maybe even what JPS is and what a public hospital is. So we're going to start at the very beginning, and we're going to do an overview and an educational process where that we bring the committee up to full speed as to what public hospitals do, what JPS does, all the details of that, and then move forward into what we're doing with HMA, what we're expecting out of the second RFP, and have HMA is going to be with us in those meetings. We're going to very quickly bring in coming to those meetings also, and just simply move forward. It's not just to hear the reports of HMA that the Blue Ribbon Committee is going to be their charge. Their charge is to hear those reports, analyze what they're hearing. If they need testimony, or if they want to hear from other groups, then we're going to ask, we're going to schedule that also. And then at the conclusion of that, draw those two reports in, or those two consultant reports in, and then the final determination as to a recommendation to the Commissioners Court on the needs and potentially how to go forward. That's our goal with the Blue Ribbon Committee. And that was something that we expressed to the court, I think, in March of last year. And so that was the direction that we were going to follow. Now, there's one thing about the Blue Ribbon Committee. We have the two liaisons from the hospital district. They've been named already. And the court needs to name its two liaisons to the Blue Ribbon Committee. That's so that whenever we begin those meetings, that they'll be you all will be notified, and so you can attend if you so choose. Our goal with the Blue Ribbon Committee is for those to be open meetings and public meetings, so that everyone can hear what the Blue Ribbon Committee hears and go through that process. We promised you that we would be transparent on this issue, and that's we intend to do that. Questions?
Any questions?
You want these back?
Please.
Could I have a copy of that report?
Yes, absolutely.
Yes.
Furnish one to each of us.
Yeah, we will. In fact, there was one in your packet today, but we may have it up there. We want to correct one or two of the slides. I saw an issue on there that we might want to correct. I want to talk about that.
Warren, is it possible for you to segment the population, the ratio of documented versus undocumented in the population that you show us?
Yes, in our community health needs assessment, we relied upon a report that was issued, I believe, about 18 months ago that tried to estimate the percentage of the population in Texas who are undocumented. So we do have that as a
Who's the
source.
author of that report?
If you give me a minute, I'll look it up. It definitely was not an official U.S. Census number. So but it's the only available one we could find, so it's certainly debatable in terms of whether it's exactly what that percentage is. But it is part of our population projection.
And just a point of clarification, when we talk about that certain segment of the population, JPS's current policy as it relates to that is that undocumented are treated, but they are considered non-Tarrant County residents so far as the pay is concerned. So that's what their policy is.
Treated in the emergency room.
Emergency room, or if they have doctor's appointments or anything, we treat them just like like someone from Johnson County or Ellis County or whatever. So.
That's correct, and the federal EMTALA Act does require all Medicare participating hospitals to provide emergency care to all who come. And so that's
as long as I don't use any federal dollars to pay for it.
Well,
right.
That's true, except that there are some provisions of the uncompensated care funding that recognizes that there is a percentage of population that is uninsured. So it's a vague area, Judge Whitley, but the fact is that all of the hospitals in Tarrant County, and we have this as part of our table report, the amount of uncompensated or Medicaid care that they give, and it's an important factor to the safety net system as a whole.
Does your uncompensated care number take into consideration that bad debt is not, doesn't qualify as uncompensated care?
We have a footnote in our table that acknowledges there are different ways that some hospitals nationally and regionally report certain numbers. So is it accurate to the 1%? I can't tell you if it's absolutely accurate, but from a magnitude viewpoint, I think it is accurate information showing that the burden for uncompensated and Medicaid, which does not pay 100% of costs, is a burden on all of the hospitals in Tarrant County.
One area that I haven't seen in this report, and maybe it's not part of the scope, is the assessment of the available technology as well as future technology that may be used to resolve some of the problems that we are facing. Is that part of the scope at all?
When we look at the future of population health management and ambulatory care, the electronic health record, telemedicine, remote monitoring are all technologies that will help primary care physicians be more efficient and effective in the care that they give. One very important take-home is that all of the hospitals in Tarrant County use the same electronic health record called EPIC. You should celebrate that fact because many communities nationally wish they had all of their hospitals using the same system. Why is that important?
That emerged over time. It didn't start out that way.
Okay, but you've got it. And what's really important there is that it makes it more feasible for collaboration and for conversations among all of the hospitals with regard to the safety net population, because you can, with proper safeguards on HIPAA and security, you can begin to look at information and trends of the care in a way that would be more difficult if we had 10 different electronic health records. In fact, the EPIC system in other parts of the country that we've worked with, for example, the Maricopa Integrated Health System in Phoenix, which is the public hospital there, are using EPIC in collaboration with other hospitals for a population health management tool, which EPIC provides. And that's a way that you can start to make some better decisions. So we are acknowledging that in our report, and the use of EPIC as a platform for strategy, clinical planning is an important asset that you actually can enjoy. But you're right, technology, who knows where it will be if we have self-driving cars. I hope we don't have self-providing robot physicians in the next century. But we do think that technology will help, but this is still a person-centered care, and this gets back to the shortage of providers. You can have all the technology in the world, but if we're short significantly in the number of primary care physicians, we will struggle to provide access to everyone. So medical education is really important, and keeping people locally here in Tarrant County, physicians and nurse practitioners who are trained here at our medical schools and stay here. And that's an important strategy for the county to support.
Any other questions? Any other business?
That's all we have at this time.
At this time, then, we stand adjourned.
Thank you.
Chief Kelly?
Yes, sir.